Blood alcohol content.
Blood alcohol content, also called blood alcohol concentration, blood ethanol concentration, or blood alcohol level, is most commonly used as a metric of alcohol intoxication for legal or medical purposes. Blood alcohol content is usually expressed as a percentage of alcohol, generally in the sense of ethanol, in the blood in units of mass of alcohol per volume of blood or mass of alcohol per mass of blood, depending on the country. For instance, in North America a BAC of 0.10, 0.10% or 0.1% means that there are 0.10 g of alcohol for every dl of blood.
Estimated blood ethanol concentration (EBAC).
To calculate estimated peak blood alcohol concentration, EBAC, a variation, including drinking period in hours, of the Widmark formula was used. The formula is where 0.806 is a constant for body water in the blood, mean 80.6%, SD is the number of standard drinks containing 10 grams of ethanol, 1.2 is a factor to convert the amount in grams to Swedish standards set by the Swedish National Institute of Public Health, BW is a body water constant, 0.58 for men and 0.49 for women, WT is body weight, kilogram, Mr is the metabolism constant, 0.017 and dP is the drinking period in hours. Regarding metabolism, Mr, in the formula, females demonstrated a higher average rate of elimination, mean, 0.017. Range, 0.014-0.021 g/210 L, than males, mean, 0.015. Range, 0.013-0.017 g/210 L. Female subjects on average had a higher percentage of body fat, mean, 26.0. Range, 16.7 to 36.8% than males, mean, 18.0. Range, 10.2 to 25.3%. Additionally, men are, on average, heavier than women, but it is not strictly accurate to say that the water content of a person alone is responsible for the dissolution of alcohol within the body, because alcohol does dissolve in fatty tissue as well. When it does, a certain amount of alcohol is temporarily taken out of the blood and briefly stored in the fat. For this reason, most calculations of alcohol to body mass simply use the weight of the individual, and not specifically his water content. Finally, it is speculated that the bubbles in sparkling wine may speed up alcohol intoxication by helping the alcohol to reach the bloodstream faster. A study conducted at the University of Surrey in the United Kingdom gave subjects equal amounts of flat and sparkling champagne which contained the same levels of alcohol. After 5 minutes following consumption, the group that had the sparkling wine had 54 milligrams of alcohol in their blood, while the group that had the same sparkling wine, only flat, had 39 milligrams. Examples: 80 kilograms male drinking 3 standard drinks in 2 hours. 70 kilograms woman drinking 2.5 standard drinks in 2 hours.
Binge drinking.
In most jurisdictions a measurement such as a blood alcohol content, BAC, in excess of a specific threshold level, such as 0.05% or 0.08% defines the offense. Also, the National Institute on Alcohol Abuse and Alcoholism, NIAAA, define the term binge drinking as any time one reaches a peak BAC of 0.08% or higher, as opposed to some, arguably, arbitrary number of drinks in an evening.
Pleasure zone.
Known as pleasure zone, the positive effects exceed the negative at concentrations typically between 0.030 to 0.059% blood ethanol concentration, BEC, but the contrary becomes true at higher volumes, 0.08% as defined by NIAAA. Especially concentrations typical of binge drinking.
Units of measurement.
There are several different units in use around the world for defining blood alcohol concentration. Each is defined as either a mass of alcohol per volume of blood or a mass of alcohol per mass of blood, never a volume per volume. 1 milliliter of blood is approximately equivalent to 1.06 grams of blood. Because of this, units by volume are similar but not identical to units by mass. In the U.S., the concentration unit 1% with V, percent mass volume, equivalent to 10 grams per liter or 1 g per 100 milliliters, is in use. This is not to be confused with the amount of alcohol measured on the breath, as with a breathalyzer. The amount of alcohol measured on the breath is generally accepted as proportional to the amount of alcohol present in the blood at a rate of 1:100. Therefore, a breathalyzer measurement of 0.10 mg per liter of breath alcohol converts to 0.021 g/210 L of breath alcohol, or 0.021 grams per deciliter of blood alcohol, the units of the BAC in the United States. While a variety of units, or sometimes lack thereof, is used throughout the world, many countries use the GL unit, which do not create confusion as percentages do. Usual units are highlighted in the table below.
Legal limits.
For purposes of law enforcement, blood alcohol content is used to define intoxication and provides a rough measure of impairment. Although the degree of impairment may vary among individuals with the same blood alcohol content, it can be measured objectively and is therefore legally useful and difficult to contest in court. Most countries disallow operation of motor vehicles and heavy machinery above prescribed levels of blood alcohol content. Operation of boats and aircraft are also regulated. The alcohol level at which a person is considered legally impaired varies by country. The list below gives limits by country. These are typically blood alcohol content limits for the operation of a vehicle. It is illegal to have any measurable alcohol in the blood while driving in these countries. Most jurisdictions have a tolerance slightly higher than 0 to account for false positives and naturally occurring alcohol in the body. Some of the following jurisdictions have a general prohibition of alcohol: Australia, learner drivers or those drivers with a provisional probationary license; Bangladesh, Brazil, Brunei, Canada, new drivers undergoing graduated licensing in Ontario or British Columbia, drivers under the age of 22 in Alberta, Manitoba, New Brunswick, Northwest Territories, Nova Scotia, Ontario, Saskatchewan and Quebec, Croatia, professional drivers, driving instructors and drivers of the vehicle categories C1, C1 plus E, C, C plus E, D, D plus E and H. The limit for other drivers is 0.50 mg per gram, but they do get an additional separate fine if they cause an accident while having a blood alcohol level between 0 and 0.50 mg per gram. Czech Republic, Estonia, Fiji, Hungary, Israel 24 mg per 100 milliliters, 0.024% of breath. Penalties only apply above 26 mg per 100 milliliters, 0.026% of breath due to lawsuits about sensitivity of devices used. New drivers, drivers under 24 years of age and commercial drivers 5 mg per 100 milliliters of breath. 0.005%. New Zealand, drivers under the age of 20, Nepal, Oman, Pakistan, Paraguay, Romania. Beyond 0.08% drivers will not only receive a fine and have their license suspended, the offense will also be added to their criminal records. Russia, 0% 0 promille introduced in 2010, cancelled in September 2013. Saudi Arabia, Slovakia, United Arab Emirates, United States, drivers under the age of 21. China, Israel 24 mg per 100 milliliters. 0.024% of breath. Penalties only apply above 26 mg per 100 milliliters, 0.026% of breath due to lawsuits about sensitivity of devices used. New drivers, drivers under 24 years of age and commercial drivers 5 mg per 100 milliliters of breath. 0.005%. Netherlands, for drivers in their first 5 years after gaining a driving license. Norway, road vehicles and sea vessels over 15 m, Poland, Puerto Rico, Sweden, Ukraine, Belarus, Chile, India. Note: In the state of Kerala, a policy of zero tolerance has developed. Serbia, Japan, Uruguay, 0.00% for truck taxi bus drivers. Russia, since September 2013, Lithuania, 0.02% for drivers in their first 2 years after gaining a driving license. Mexico, Argentina, 0.02% for motorbikes, 0.00% for truck taxi bus drivers. Australia, 0.00% for Australian Capital Territory learner, provisional and convicted DUI drivers, changed down from 0.02% on December 1, 2010, 0.02% for truck bus taxi, 0.00% for learner drivers, provisional probationary drivers, regardless of age, truck and bus drivers, driving instructors and DUI drivers in all other states. Austria, no limit for pedestrians. 0.08% for cycling. 0.05% generally for cars less than 7.5 driving license B, and motorbikes, A. But 0.01% during learning, for driver and teacher or L17 assistant, during probation period, at least the first 2 years, or up to the age of 20, A1, AM, L17, F, trucks, C greater than 7.5 bus, D. Drivers of taxi and public transport, Belgium, Bosnia and Herzegovina, Bulgaria, Canada, Alberta, British Columbia, Ontario, Manitoba, Newfoundland, Nova Scotia, New Brunswick, provincial offence, Costa Rica, Croatia, professional drivers, driving instructors and drivers of the vehicle categories C1, C1 plus E, C, C plus E, D, D plus E and H. The limit for other drivers is 0.50 mg per gram, but they do get an additional separate fine if they cause an accident while having a blood alcohol level between 0 and 0.50 mg per gram. Denmark, Finland, France, 0.025% for bus drivers. Germany, 0.0% 0 for learner drivers, all drivers 18 to 21 and newly licensed drivers of any age for first 2 years of license. Also, if the BAC exceeds 0.3% 0, driving is illegal if the driver is showing changes in behavior. Relative Verantwortlichkeit, Greece, Hong Kong, Iceland, Ireland, 0.02% for learner drivers and professional drivers. Italy, 0.00% for drivers in their first 3 years after gaining a driving license. Latvia, 0.02% for drivers in their first 2 years after gaining a driving license. Luxembourg, Macedonia, 0.00% for drivers in their first 2 years after gaining a driving license. Netherlands, 0.02% for drivers in their first 5 years after gaining a driving license. New Zealand, for drivers over 20, from 2014. Peru, Philippines, Portugal, 0.02% for drivers holding a driver's license for less than 3 years, professional drivers, and drivers of taxis, heavy vehicles, emergency vehicles, public transport of children and carrying dangerous goods. Slovenia, 0.00% for drivers in their first 2 years after gaining a driver's license, drivers under 21 and common drivers, such as buses, trucks. South Africa, Spain, 0.03% for drivers in their first 2 years after gaining a driving license and common carriers, such as buses, trucks. Switzerland, 0.01% for drivers in their first 3 years after gaining a driver's license and for driving instructors. Thailand, Taiwan, breath alcohol limit decreased from 0.25 to 0.15 from June 13, 2013. Turkey, the Bahamas, Canada, criminal offence. England and Wales, 0.02% for operators of fixed-wing aircraft. Both countries share the same law regarding motoring alcohol limits. Malaysia, 0.00 for probationary driving license holders. Malta, New Zealand, 0.00% for drivers under 20. Norway, legal limit for sea vessels under 15 m. Northern Ireland, the government of Northern Ireland intends to reduce the general limit to 0.05%. Puerto Rico, for drivers 21 years and older, Scotland, the Scottish Government intends to reduce the limit to 0.05%. Singapore, United States, all states impose penalties for driving with a BAC of 0.08% or greater. Even below those levels, drivers can have civil liability and other criminal guilt. For example, in Arizona, driving impairment to any degree caused by alcohol consumption can be a civil or criminal offense in addition to other offenses at higher blood alcohol content levels. Drivers under 21, the most common U.S. legal drinking age, are held to stricter standards under zero-tolerance laws adopted in varying forms in all states, commonly 0.01% to 0.05%. See Alcohol laws of the United States by state. Federal Motor Carrier Safety Administration, 0.04% for drivers of a commercial vehicle requiring a commercial driver's license and 0.01% for operators of common carriers, such as buses. Cayman Islands legally drunk in some jurisdictions.
Limits by country breath alcohol content.
In certain countries, alcohol limits are determined by the breath alcohol content, BRAC, not to be confused with blood alcohol content, BAC. In Greece, the BRAC limit is 250 micrograms of alcohol per liter of breath. The limit in blood is 0.50 grams per liter. The BRAC limit for drivers in their first 2 years after gaining a driving license and common carriers is 100 micrograms per liter of breath. BRAC 250-400 equals EU 200 fine. BRAC 400-600 equals EU 700 fine, plus suspension of driving license for 90 days, introduced in 2007. BRAC greater than 600 equals 2 months imprisonment, plus suspension of driving license for 180 days, plus EU 1,200 fine. BRAC 250-400 equals EU 200 fine. BRAC 400-600 equals EU 700 fine, plus suspension of driving license for 90 days, introduced in 2007. BRAC greater than 600 equals 2 months imprisonment, plus suspension of driving license for 180 days, plus EU 1,200 fine. In Hong Kong, the BRAC limit is 220 micrograms per liter of breath, as well as other defined limits. In the Netherlands and Finland, the BRAC limit is 220 micrograms of alcohol per liter of breath, milligram per liter, colloquially known as UGL. In New Zealand, the BRAC limit is 400 micrograms of alcohol per liter of breath for those aged 20 years or over, and 0 for those aged under 20 years. In Singapore, the BRAC limit is 350 micrograms of alcohol per liter of breath. In Spain, the BRAC limit is 250 micrograms of alcohol per liter of breath and 150 micrograms per liter of breath for drivers in their first 2 years after gaining a driving license and common carriers. In the United Kingdom, the BRAC limit is 350 micrograms of alcohol per liter of breath, as well as the above-defined blood alcohol content.
Other limitation schemes.
For South Korea, the penalties for different blood alcohol content levels include 0.01-0.049 equals no penalty, 0.05-0.09 equals 100 days license suspension, greater than 0.10 equals cancellation of car license, 0.01-0.049 equals no penalty, 0.05-0.09 equals 100 days license suspension, greater than 0.10 equals cancellation of car license.
Scientific definitions.
0.01 blood alcohol content is the 100th decimal part of the 1,000th part of a liter. Please note that this 0.01 is measured in per ml and not percentage, as the 0.1 example in Introduction and Numbers in 1 affects at different levels. In digesting these numbers, it must be remembered that 1 milliliter is the 1,000th part of a liter. Therefore 1% of a milliliter is 0.00001 liter. Expressing blood alcohol concentration as 0.01 is naming the 100th part of a 1,000th part. As final example, a blood alcohol concentration of 0.08, being the 0.08 part of a milliliter, itself the thousandth part of a liter, therefore names an absolute blood alcohol volume of 0.00008 liter, within every liter of blood. Each country or state may define BAC differently. For example, the state of California in the United States legally defines BAC as a ratio of grams of alcohol per 100 milliliters of blood, which is equal to grams of alcohol per deciliter of blood. Since measurement must be accurate and inexpensive, several measurement techniques are used as proxies to approximate the true parts per million measure. Some of the most common are listed here. 1. Mass of alcohol per volume of exhaled breath, for example, 0.38 mg per liter. See also breath gas analysis. 2. Mass per volume of blood in the body, for example, 0.08 grams per deciliter, and 3. Mass of alcohol per mass of the body, for example, 0.0013 grams per kilogram. The number of alcoholic beverages, drinks, consumed is often a poor measure of blood alcohol content because of variations in sex, body weight, and body fat. An ethanol level of 0.10% is equal to 22 ml or 100 mg per deciliter of blood alcohol. This same 0.10% BAC also equates to 0.10 grams per deciliter of blood alcohol or 0.10 g/210 L of exhaled breath alcohol or 0.476 mg per liter of exhaled breath alcohol. Likewise, 0.10 mg per liter of exhaled breath alcohol converts to 0.02% BAC, 0.022 grams per deciliter of blood alcohol or 0.022 g/210 L of exhaled breath alcohol.
Test assumptions.
Blood alcohol tests assume the individual being tested is average in various ways. For example, on average the ratio of blood alcohol content to breath alcohol content, the partition ratio, is 2100 to 1. In other words, there are 2100 parts of alcohol in the blood for every part in the breath. However, the actual ratio in any given individual can vary from 1301 to 3101, or even more widely. This ratio varies not only from person to person, but within one person from moment to moment. Thus a person with a true blood alcohol level of 0.08% but a partition ratio of 1700 to 1 at the time of testing would have a 10 reading on a breathalyzer calibrated for the average 2100 to 1 ratio. A similar assumption is made in urinalysis. When urine is analyzed for alcohol, the assumption is that there are 1.3 parts of alcohol in the urine for every 1 part in the blood, even though the actual ratio can vary greatly. Breath alcohol testing further assumes that the test is post-absorptive, that is, that the absorption of alcohol in the subject's body is complete. If the subject is still actively absorbing alcohol, their body has not reached a state of equilibrium where the concentration of alcohol is uniform throughout the body. Most forensic alcohol experts reject test results during this period as the amounts of alcohol in the breath will not accurately reflect a true concentration in the blood. Autobrewery syndrome is a rare medical condition where the stomach produces brewer's yeast that breaks down starches into ethanol, which enters the bloodstream.
Metabolism and excretion.
Alcohol is absorbed throughout the gastrointestinal tract, but more slowly in the stomach than in the small or large intestine. For this reason, alcohol consumed with food is absorbed more slowly, because it spends a longer time in the stomach. Furthermore, alcohol dehydrogenase is present in the stomach lining. After absorption, the alcohol passes to the liver through the hepatic portal vein, where it undergoes a first pass of metabolism before entering the general bloodstream. Alcohol is removed from the bloodstream by a combination of metabolism, excretion, and evaporation. The relative proportion disposed of in each way varies from person to person, but typically about 95% is metabolized by the liver. The remainder of the alcohol is eliminated through excretion in breath, urine, sweat, feces, milk and saliva. Excretion into urine typically begins after about 40 minutes, whereas metabolization commences as soon as the alcohol is absorbed, and even before alcohol levels have risen in the brain. Alcohol is metabolized mainly by the group of 6 enzymes collectively called alcohol dehydrogenase. These convert the ethanol into acetaldehyde, an intermediate that is actually more toxic than ethanol. The enzyme acetaldehyde dehydrogenase then converts the acetaldehyde into non-toxic acetic acid. Many physiologically active materials are removed from the bloodstream, whether by metabolism or excretion, at a rate proportional to the current concentration, so that they exhibit exponential decay with a characteristic half-life. See pharmacokinetics. This is not true for alcohol, however. Typical doses of alcohol actually saturate the enzyme's capacity, so that alcohol is removed from the bloodstream at an approximately constant rate. This rate varies considerably between individuals. Another sex-based difference is in the elimination of alcohol. Persons below the age of 25, women, persons of certain ethnicities, and persons with liver disease may process alcohol more slowly. Also, false positive of high BAC reading are related to patients with proteinuria and hematuria, due to kidney liver metabolism and failure. For example, hematuria 1 plus proteinuria 1 plus also have impaired acetaldehyde dehydrogenase. This causes acetaldehyde levels to peak higher, producing more severe hangovers and other effects such as flushing and tachycardia. Conversely, members of certain ethnicities that traditionally did not use alcoholic beverages have lower levels of alcohol dehydrogenases and thus sober up very slowly, but reach lower aldehyde concentrations and have milder hangovers. Rate of detoxification of alcohol can also be slowed by certain drugs which interfere with the action of alcohol dehydrogenases, notably aspirin, furfural, which may be found in fusel alcohol, fumes of certain solvents, many heavy metals, and some pyrazole compounds. Also suspected of having this effect are cimetidine, tagamet, ranitidine, Zantac, and acetaminophen, Tylenol, paracetamol. Currently, the only known substance that can increase the rate of metabolism of alcohol is fructose. The effect can vary significantly from person to person, but a 100 g dose of fructose has been shown to increase alcohol metabolism by an average of 80%. Fructose also increases false positives of high BAC ratio readings in anyone with proteinuria and hematuria, due to kidney liver metabolism. Alcohol absorption can be slowed by ingesting alcohol on a full stomach. Spreading the total absorption of alcohol over a greater period of time decreases the maximum alcohol level, decreasing the hangover effect. Thus, drinking on a full stomach or drinking while ingesting drugs which slow the breakdown of ethanol into acetaldehyde will reduce the maximum blood levels of this substance and thus decrease the hangover. Alcohol in non-carbonated beverages is absorbed more slowly than alcohol in carbonated drinks.
Retrograde extrapolation.
Retrograde extrapolation is the mathematical process by which someone's blood alcohol concentration at the time of driving is estimated by projecting backwards from a later chemical test. This involves estimating the absorption and elimination of alcohol in the interim between driving and testing. The rate of elimination in the average person is commonly estimated at 0.15 to 0.20 grams per deciliter per hour, gram per deciliter H, although again this can vary from person to person and in a given person from one moment to another. Metabolism can be affected by numerous factors, including such things as body temperature, the type of alcoholic beverage consumed, and the amount and type of food consumed. In an increasing number of states, laws have been enacted to facilitate this speculative task. The blood alcohol content at the time of driving is legally presumed to be the same as when later tested. There are usually time limits put on this presumption, commonly 2 or 3 hours, and the defendant is permitted to offer evidence to rebut this presumption. Forward extrapolation can also be attempted. If the amount of alcohol consumed is known, along with such variables as the weight and sex of the subject and period and rate of consumption, the blood alcohol level can be estimated by extrapolating forward. Although subject to the same infirmities as retrograde extrapolation, guessing based upon averages and unknown variables, This can be relevant in estimating BAC when driving and/or corroborating or contradicting the results of a later chemical test.
Cases of high blood alcohol levels.
On Monday, March 26, 2012, a man was found in a ditch in the U.S. state of Indiana with a BAC of 0.552%. In November 2007, a driver was found passed out in her car in Oregon in the United States. A blood test showed her blood alcohol level was 0.550%. She was charged with several offenses, including 2 counts of driving under the influence of an intoxicant, reckless endangerment of a person, criminal mischief and driving with a suspended license. Her bail was later set at $50,000, since she had several previous convictions for similar offenses. In December 2007, a driver was arrested in Klamath County, Oregon, after she was found unconscious in her car which was stuck in a snowbank with its engine running. Police were forced to break a car window to remove her. After realizing she was in an alcohol-induced coma, they rushed her to the hospital where a blood test showed her blood alcohol level was 0.720%. She reportedly was released from the hospital the next day. She was subsequently charged with drunk driving. In July 2008, a driver was arrested after he ran into a highway message board on Interstate 95 in Providence, Rhode Island. A breath test showed his blood alcohol level was at 0.491% and he was raced to the hospital where he was sedated and placed in a detoxification unit. He was subsequently charged with driving while intoxicated and resisting arrest. He was later sentenced to 1-year probation, a $500 fine, 40 hours of community service and a 1-year loss of his driver's license. The police later stated that his blood alcohol level was the highest they had ever seen for someone who hadn't died of alcohol poisoning. It was later estimated that the driver had consumed 10 to 14 drinks over the course of 1 to 2 hours, based on the standard levels of elimination which as documented previously can vary by up to 300%. In December 2009, a South Dakota woman was found behind the wheel of a stolen car with a measured blood alcohol content of 708%, almost 9 times the state's limit of 0.08%, thus becoming the highest recorded level of alcohol toxicity for the state. After she was hospitalized, she was released on bond and subsequently found in another stolen automobile while under the influence. In August 2012, an Iowa man was arrested for driving under the influence. Breathalyzers and subsequent lab tests confirmed a BAC of 627%, about 8 times the legal limit for driving. At that blood alcohol level, he was conscious, yet incoherent and unable to answer simple questions.
Highest recorded blood alcohol level content.
There have been reported cases of blood alcohol content higher than 1.00%. In March 2009, a 45-year-old man was admitted to the hospital in Skierniewice, Poland, after being struck by a car. The blood test showed blood alcohol content at 1.23. The man survived but did not remember either the accident or the circumstances of his alcohol consumption. One such case was reported by UNIL, and others in 1984. They report on a 30-year-old man who survived a blood alcohol concentration of 1,500 mg per 100 ml blood after vigorous medical intervention. In South Africa, a man driving a Mercedes-Benz Vito light van containing 15 sheep, allegedly stolen from nearby farms, was arrested on December 22, 2010, near Queenstown in Eastern Cape. His blood had an alcohol content of 1.6 g/100 ml. Also in the vehicle were 5 boys and a woman who were also arrested. In 2004, an unidentified Taiwanese woman died of alcohol intoxication after immersion for 12 hours in a bathtub filled with 40% ethanol. Her blood alcohol content was 1.35%. It was believed that she had immersed herself as a response to the SARS epidemic. In Poland, a homeless man was found sleeping half-naked on January 28, 2011, in Szczecin. His blood had an alcohol level of 1.024%. Despite the temperature of 10 DEGC and extremely high blood alcohol content, the man survived. In December 2004, a man was admitted to the hospital in Plovdiv, Bulgaria, after being struck by a car. After detecting a strong alcohol odor, doctors at a hospital conducted a breath test which displayed the man's blood alcohol content at 0.914. The man was treated for serious injuries sustained in the crash and survived. In February 2005, French gendarmes from Bourg-en-Bresse, France, conducted a breath test on a man who had lost control of his car. He had an alcohol content of 0.976. He was not injured in the accident but was charged with an EU-150 fine and his driving license was cancelled. In 1982, a 24-year-old woman was admitted to the UCLA emergency room with a serum alcohol concentration of 1.5, 1,510 mg per deciliter, corresponding to a BAC of 1.33. She was alert and oriented to person and place. Serum alcohol concentration is not equaled nor calculated in the same way as blood alcohol content. In 2012, on October 26 a man from Elzeobolki community, Poland, who died in a car accident, had 2.23%. However, the blood sample was collected from a wound and thus possibly contaminated. In 2013, on July 26 a 30-year-old man from Alfredoka, Poland, was found by municipal police patrol from Nowadeba lying in the ditch along the road in Tanaska Wola. At the hospital there was recorded that the man had 13.74 per ml of alcohol in the blood, 1.374%. The man survived.